Okay, this is the stuff we're going to do today. This graph, I made it because I want you to remember, you have to imagine, this is the artery. There are 3 springs under our 3 fingers. And each spring might not have the same strength. Some of them are collapsed, or some of them are bad, or some of them are too strong. In this case, the spring under our middle finger is too strong. So it will push the artery like this. This we call convex. This is the view. So the artery is not like a just straight tube that can the blood flowing in there. It's not. It's something like this. And about the shape of this can be many varieties in there. So we'll be talking about it now. Okay? Actually, have you ever seen this? Have you ever felt this kind of a pulse ever? A lot, huh? This upward jump can be anywhere, not only in the guan. I usually do the drawing. This is my drawing, okay? 寸关尺. That's my habit. You can do whatever you like, okay? And this is the real condition inside the human body, sometimes. The pulse is a resemblance of the real pathological condition inside the human body. If the pulse is expanding somewhere, that means that part of the human body, the organs are expanding or is expanding or something. If the pulse is weak, that means that part of the body is weak, it's not functioning, or you can, as in our words, is heat, too much fire, or too much coldness, or too weak or something. So the pulse can be different. We have 6 positions, right? 寸关尺. Actually, beyond the 寸 and the 尺, we have extra meridian pulses. So whatever, those positions mean something. That will tell you where the problem is. And we can use all the feelings to get what's really happening inside the human body. And we do the treatment mechanically. That's what I always say, mechanically. What do you mean mechanically? For example, like this. It's swollen inside, so we shrink it. Right? We make it smaller. We destroy the blockage. This is blockage, right? This is exactly the same condition. Now we destroy it. We will lower this one. If it's on the other side around, it's lower or too weak, we lift it. So we do treatment mechanically according to the pulse signs. Any questions so far? No? Okay. And, 这干嘛? Okay. 下一个. Then, let's begin with all the sequence. The first is the bird's peak. Huh?
So here is a general summary. So when you find a pulse that's not straight, it's bulging and feels round under your finger, there are many different sizes of roundness. Okay? So the larger it is, the larger the stagnation in the body. The bigger the mass or the bigger the swelling. If you're dealing with prostate swelling, if it's a little round BB versus a big round BB or a marble, the bigger the pulse, the bigger the swelling. Okay? And then also, the harder it is, meaning when you push on it, it feels like there's fluid feel type of, you feel the blood underneath, or it's soft. Kind of like a pimple, a hard pimple and a soft pimple, if you will. If it's soft and you can push it away, that means this is just a minor case, it's just starting, it's not very serious, you can easily dissolve it, whatever the swelling and the obstruction. But the harder it is, meaning there's no way you can push away that BB. It just feels hard, like a marble. That means the more compacted that mass is, or that swelling in the body is, which means it's going to take stronger blood movers, take longer period of time to treat. So that's a general principle of what the bulging pulses are.
Oh.
So I want you guys to go to your notes now, take the green sheet of paper out.
This
the green sheet is a summary. This took
This is my design, and it's Lily's work to make this graph so pretty. This is a combination of what's possible pulse signs might appear on the pulse. This is it's a little bit complicated, but you spend a few seconds reading it, then you know it's very, very useful and very commonly seen conditions.
Let's take a look at it real quick.
Concave?
Now,
concave is there.
The graph that you see it's
Yeah, no
we
conflict.
try to make it exactly like the size of your finger. So why don't you put your 寸关尺 right on the chart there? Well, that's according to the average size finger, okay? Chinese finger. Oh, your fingers are bigger. Yeah. Okay. So do you get the idea? The sizes of the different bulges, they range from, if you look at the left, bird's beak, which is this is so hard. Took a long time. Dr. Chang, how big is a bird's beak? You know, how big is a turtle? What size is a normal pulse? Yeah, it really irritated him. It's so hard to put
yourself
a
a
number
bird.
on it. He said, how can you be so scientific? I said, you have to give like a reference guide, okay? So this is approximately 0.01 centimeter, like a tip of a pen, to the bean pulse, 0.3 centimeters, about that size, okay? Short pulse is about a 0.5 centimeter, just to give you a relative idea of how big they should be. Like a turtle pulse should be the width of your finger, or the position, one position of the 寸, the 关, or the 尺. Actually, it's not your finger, it's the patient's size. You know what I mean? If you're dealing with a small patient, then it's whatever their 寸关尺 size is that dictates what that turtle should be, that size of the turtle, not your finger. But this gives you something to start with, so you know the differences. Any questions on here?
Funny
No?
names, huh? Sea
Funny
turtle,
names? Yeah.
turtle, rainbow. Any questions so far?
What? Yes, so we'll go into each of them. Okay, let's go and start with the first
Okay, about
one.
this, let me ask you a question. You can see these drawings, okay? This one is bulging and actually it's closer to the surface, so we call it floating. And anyway, the guan is too high. Is it a complete pulse sign? Why? It's not? What's missing? Yeah. I cannot show you the jump here, but I can with the animation, but I didn't do it this time. We have some animations for this, but anyway. If the jump is high and strong, that we call expanding, what does it mean? With a shape like this, huh? Excess. Yeah. If the pulse like this, but it's very stagnant, greasy, it's not moving. The heartbeat like only 55 or 60, and the amplitude is low. Then what does it mean? More stagnation, right? So there are two items we're thinking. Is the combination of fire and stagnation. Now, which one is bigger? Which part is bigger? That gives us as instruction what medicine should be put to that area. For example, if the fire is too much, we use more medicine for the fire part. Like this guy having fire like 70%. Then we use combination. I always use 100 grams of herbs for the patients. So like use 70% for the fire and 30% for clearing the stagnation. As for clearing fire, what medicine should we use? What kind of medicine should we use? I mean, what quality? Accurate? Huh? Salty? Huh? Bitter is the general saying, but try to remember, salty medicine is more important than bitter medicine for clearing the fire and stagnation. So the pulse will show us how much percentage of herbs we should put into the entire bottle for the treatment. Okay? If it's stagnant, we use more blood movers than heat clearing herbs. Is that clear? Okay. So this is the beginning of our today's class. This is the bird peak, like a sharp one. If it's happened actually in the beginning, is it a complete sign?
Oh, okay. Just so that you guys know, when you see the name of the pulse on the top left-hand corner, and if it's in title case, that means it's not a complete pulse sign. Later on, when you see all caps in the name of a pulse, that's a complete pulse sign. This is a reminder for you. And also on the right-hand side, top right here, the reason why we put 3 little pen tips here is because it could appear in all 3 positions. And usually in the 寸 position, higher up, guan and chi deeper, you will find these pulses. Okay.
Yep.
So Jimmy has something he made up to show you. This is his animation.
Something like that. I'll do more next time. So what you may ask is, how come the artery has something like a sharp point upward like that? Let me explain something about this very big. In generally speaking, when we do our daily practice, we see this as a constriction. So if the pulse, just like this, appears on here and here with different, they will have different explanation. But in general, this burst peak, if it's very hard, actually, what do you mean hard? What hard means that if you push a little harder, it won't disappear. It still be there. This pulse should, this tip. So that's what I emphasize. You should touch the pulse gently, very gently. And then you push down. See if you can destroy this triangle, this little peak here. If it collapses under your finger, under your pressure, then it's good. There's nothing serious. But no matter if it's still there, just like touching your ball pen, the pen tips, no matter how hard you try, you cannot destroy it, right? It will still be there. That means the dead pulse of spleen. Actually, it's a cancer pulse. It's some kind of a cancer tumor, neoplasm or something. It's very dangerous in the beginning. So if the pulse be there all the time, you cannot make it disappear by pressing harder, then it's something bad. Okay? If it collapses, and that means we always say it's soft, it's not so hard, then that's okay, just temporarily some sickness. For example, in the right turn, it's the constriction of the upper respiratory system. We say is the accumulation of fluid in the pulmonary area. So there's a lot of water in the respiratory system, and it's not very good. Sometimes you have a lot of congestion in the chest. Also remember we can also call this is a short pulse, and short pulse related to large intestine. And this right turn area is also related to large intestine. So a pulse appear like this, there can be something congested in the large intestine. How hard? I mean, how serious the problem is depends on how hard the pulse is. If the pulse harder, like a plastic material, then the condition is severe. Maybe some cancer or something. If it's soft and it can be destroyed easily by your pressure, then it's just some temporary sickness. It's not so important. So, actually, in this condition, when you say about the respiratory system, there's a lot of water accumulated in there. This pulse originally belonged to spleen. This is a dead pulse of spleen. Well, if it's too hard, okay? Just really like a bird's beak, that hard, then it's bad stuff, huh? Okay, so this one is, do you have the bird's beak in your right one? Check it a little bit. Remove your watch, roll up your sleeves, both of them. Try to feel your own pulse. Like I said, I said again, you have to touch the skin very gently in the beginning. Then you can press down a little bit and then let go right away. Gently. I can see from here, you're pushing too hard. You're pushing too hard. I can see it from here. For those who are here first, you should keep your thumb against the back of your wrist and do it like this. Keep this opening here so it'll be easier. This is leverage. So you'll be able to maneuver your fingers freely. Don't hold your fingers, don't hold the pulse like this. When you take other people's pulse, you do the same. You use the thumb against this wrist like a leverage so you'll be able to move your fingers in a free way. Okay? Don't hold it like this. Huh? And don't leave this thumb in the air. Some people taking the pulse like this. That's not real pulse. You take pulse from outside, and when you take patient's pulse, make them their palm not facing the ceiling, facing the side. Then you take it from outside. when he gives you a right hand, that's my habit. I always sit here and let my patient sit to my left. I take the right first and left first, left second. Don't take both paws with one hand. That's fake too. Okay. 来，这是什么 ？Okay, this is 等下还没完呢。But the very big pause can happen anywhere. I find out this line can be very, very useful. See the double cross line? These lines? That's the 寸, that's the 关, that's the 尺, and this is beyond the 寸, and this is beyond the 尺, and this is in between. This is in between because we always find some pauses, some bulging, some kind of a stagnation, some cyst or blockage in between this lines. I mean, in between the 寸 and 关, something can happen in here or here. So, just that cross can be very, very useful for your analyzing the pauses. So I think you should stick to it and buy yourself some crayon. The ball pen is not thick enough to express our feelings. You know what I'm saying? Okay. Okay. If the sharp pause never happened between 寸 and 关, this is 寸, this is 关, this is 尺. Okay, that's our habit. If it happens a lot in the 关, why this drawing is so under? This is the level, huh? This is not the skin, okay? This is the mid-level of the artery. Skin is here. 要不要把这个图放大一下？有没有图？没有图。So why is it so deep? Because it's always like that. This is the 那个什么 gallstone. And this can be the kidney stone. Okay? Gallstone, of course, it happened on left hand only. The kidney stone can be either hands. Huh? Yes, kidney stone. The triangle is very good. Just like that. The real pulse is just like that. Sharp, like a small triangle. We call it bird's peak, pen tip, whatever.
Jimmy, if you find it on the right one,
yeah.
What do you think it is usually?
And that's not good. There's something inside the stomach. Something, either a scar or tumor. The smaller the pulse, the worse it can become. The harder the pulse, definitely is worse. It's more dangerous. So ideally, the pulse should be soft and weak. So sometimes I tell the patient, hey, your condition is quiet. That's good. What do you mean quiet? It's not, nothing is jumping, no fire inside. Everything is so quiet. All the systems are working perfectly. I don't like the hard pulses or feelings. Anything that's hard is not good. Like this paper, it's not hard, it's soft. But those solid stuff are really hard. No matter how hard you press it, it won't go away. So if it happens on the pulse, on the artery, that's always a bad sign. Can you see? Okay.